Aloha, folks, and welcome to this edition of Five Questions. It's a conversation that appears on News Radio 830 KHVH right here on the Rick Hamada program, and also the homepage of HawaiiReporter.com. Be sure and log on every day. It's a delight to get together with Dr. Josh Green. He is our state senator on the Big Island and joins us today. Great conversation. Looking forward to it. Josh, thanks for being with us.
It's really an honor to talk to you.
You know, can we jump into question number one? And that would be, in your mind, the priorities and a preview of the upcoming legislative session.
You bet. From a health perspective, I'm the chairman of the Health Committee in the Senate. I've broken it down into three areas, which I think will probably will weave in and out of some of these issues, I'm sure. One, keeping our hospitals solid or reopening certain service lines if necessary. Two, looking at the provider shortage, particularly the shortage of physicians. And then three, I'll be looking at some environmental health issues. So in order to really break it up, because it's such a huge issue, that's kind of how my team is looking at it.
Understand. And you're right, there'll be some intertwining here and there. And let's start with number one of your list, and that's what has a lot of us concerned here on Oahu as well, is the closure of HMC East and West.
Right.
Can you give us your take on the situation, and from a legislative standpoint, what could be the next step?
Okay, so let me first start people off with why HMC closed.
Sure.
So HMC, 70% of the patients are on Medicare or Medicaid, and something I'm sure that you've addressed and pointed out in past shows is that the government payers are too low. The reimbursements tend to be much too low to sustain services anywhere in the country. So from my perspective, this is kind of the tip of the iceberg, and normally hospitals have a payer mix of about 60% Medicare or Medicaid, and HMC had 70%, and that meant that because those reimbursements from the government were too low, the hospital was constantly underfunded, which made it hard to keep physicians in practice and pay for the emergency department and so on. So that's why they struggled and ultimately closed. The good news is that we have some very good business people in the state, and I do believe it will likely be Hawaii Pacific Health that will step in. They're certainly considering acquiring the two hospitals, and I'm hopeful that they'll be able to make the numbers work, and then start those services back up. What you probably saw also in the last couple of weeks is at the legislature we're prioritizing keeping things going until that can happen. So we're moving the organ transplant program over to Queens. Art Ushijima is a terrific guy, and he's taking that on. And we're hoping to get the liver center up and running very soon. It's also going to be at Queens. So this legislature is going to help a little bit, but in general, these are very big operations, and government just can't run them. So the hospital closing, while having a huge impact on our people locally right now, hopefully will be reopened within the course of several months.
Two sidebar quick questions regarding that. One, you described the financial model which led to HMC's demise.
Yep.
How would that change under the new ownership? And secondarily to that, one of the tenets of governance is to provide very basic core functions, and safety and security one of those, and many of us believe that, hospital care, health care comes under that provision. Do you believe there should have been at any point an intervention by the state that would have prevented or could have prevented the bankruptcy of HMC, maybe in some way to assist in the continuity of that service?
Those are some big questions, so let's take them kind of one by one. First of all, yes, I do think that the government needs to protect certain services, and healthcare is one of them. It can't underwrite everything, in a hospital, though HHSC, which is the Hawaii Health Systems Corporation, does receive a pretty significant subsidy, and that keeps rural hospitals open in particular. But for the most part, urban hospitals don't get that kind of support because the economics of urban hospitals tends to be better. That's one part of the question to a very big, complex issue. And the question also you ask is very good about why will it work the next time. Well, Hawaii Pacific Health has done a lot of strong work on streamlining services, doing reimbursements based on outcomes. They have a very vibrant electronic health record network and system, so they may very well be able to keep costs down somewhat. But they're aware that the challenge is great. I'll again reiterate that when the payer mix of people that are seen at a hospital is as high as 70% Medicaid and Medicare, it ends up being a huge challenge. And so it really boils down to what the federal guys and what we state guys can do with a budget to support healthcare services. I'm a healthcare provider. I'm an emergency room physician, and so I'm very committed to making that an essential service. But this is a battle that goes on at the legislature and government branches all across the country every year.
Certainly. Dr. Josh Green, Senator from the Big Island, is our guest on this edition of 5 Questions. And it kind of leads us to another area you touched upon, and that is the challenge of retaining physicians here in Hawaii. What's the primary causation of the departure of physicians, and what can we do to create an environment where it's nurturing for them?
Good questions again. So, well, to give you an example, I came to Hawaii in 2000 with a National Health Corps scholarship, and what that meant was they paid back my student loans, my medical school loans, which were about $140,000 at the time. They're now even much higher. Now it's as much as $200,000 on average for young physicians getting out of school. So that made it possible for me to come to a very rural area. And I don't want to make it about money. It's just that we do get out-competed by places like California, Texas, Pennsylvania, New York, where they can offer a much more competitive salary a lot of times. And so our trained physicians, good young people, if they have that amount of debt, might be lured out there. So right now we have a 22% shortage across the board for all doctor subspecialties, including primary care, and it's really driving what we're going to be as a healthcare system. So one of the things that I continuously fight on is a loan repayment program bill, and I think the reason we should do this is because for every dollar we put in as a state or the private sector, either one, we get $1 from the federal government to pay back student loans for med students or for graduates of medical school. And I think that that's a pretty good investment because if we don't have these physicians, we end up flying all over the place, or God forbid we even have to go over to California, Stanford, and what have you to get care, which is a terrible investment. So I'm trying to focus on things that are kind of nonpartisan, non-controversial, that will really dig right into the problem. So that's one major thing. But again, in Hawaii, the reimbursements for Medicare are among the nation's lowest, and even for the private payers, they're somewhat low. And so that does create a problem. And we've historically struggled, but the matter is getting worse, and we're seeing that reflected in our provider base right now.
Appreciate all that and more. With time permitting, I'd like to get a little bridge question in, and that has to do about long-term care, and the implications of our aging population here in Hawaii is quite profound.
You bet.
What is the preparation for the inevitable regarding long-term care?
Right now we're building out more beds. It's been a big, big problem. In some ways, this is a most important area to focus on because with a shortage of long-term care beds, what results is, and we're on any given day in the year short about 200 to 250 long-term care beds across the state. If I need to be into a rehab bed or a long-term care bed as a patient, but there isn't one available, I get stuck in a regular hospital bed. And the government, usually Medicare, will not reimburse the hospital at all. So places like Queens, which is a great hospital, Straub, terrific hospital, so many good services all across HHSC get reimbursed nothing. And they end up having about $150 million of losses. Essentially, they call it charity care, so they don't get any reimbursement for that service. And that ends up causing a big problem. It's why some hospitals get very near to closing or, God forbid, actually close like HMC. So solving this problem, this long-term care shortage of beds, can actually turn the entire health economics into the black and in the right direction. And what I would expect to see, and what I'm hearing, is that should Hawaii Pacific Health or another business here in Hawaii decide to buy HMC, I think they'll repurpose the smaller hospital to be almost exclusively long-term care. So it will have a twofold benefit. Number one, we'll have the main hospital and the emergency department and all of the services there and all the good doctors there to see, but we'll also have more long-term care beds. So I think that that's the direction we'll see it heading.
Appreciate the response as well. And Dr. Josh Green joining us, State Senator from the Big Island, and you're on 5 Questions. We're actually toward the end of our conversation for now, but this has to do with 2 points. One, this incredible drug shortage that we were made aware of toward the latter part of 2011. Can you expand upon the situation here and just how precarious is it for us here at home?
Absolutely, Rick. Another good question. So we delved into that last year. When I saw that the shortage was starting to spread across the country, I started contacting some of the pharmaceutical companies, and what we had seen in that particular case when we had shortage of some of the cancer drugs was kind of a perfect storm. On the one hand, those drugs were no longer significantly profitable, and I really don't think that should be the calculation, but I'm a realist. I mean, I know any company has to make money in order to do good business, but that drug line hadn't been profitable enough so that when they only were making the drugs at one place, this is Doxil, it's a cancer drug for people with ovarian cancer and some other cancers, and then the factory ended up having a problem making the drug. There was no ability to go somewhere else and get it from another source. So all of a sudden, we went from having a regular, adequate supply across the country to nothing. And there are over 200 drugs that the Food and Drug Administration have seen short or in short supply. So what I've called on the congressional delegation to do is to take a look at creating some safety net or some redundancy in the process. And I'm willing, and I really want to be fair to any industry, if they have to incur extra cost, I think they should get some kind of tax break to offset that extra investment. But it's in the interest of people, because you can imagine the worst thing you can ever hear is your doctor tell you you've got cancer, or God forbid your child's got some severe illness, but then on the other hand, we can't get any treatment for you because the medication's not available. So this is, again, and you alluded to it, there are certain fundamental things that only a big institution can do. I mean, a lot of us want, and I'm sure you're among them, want smaller government, not too much involvement, but you can't expect one small company or something like that to take on a whole problem like the drug shortage. So this is where I think we have to rely on some support from government agencies to make sure that we don't end up in a really bad, precarious situation.
I understand, without a doubt. And our final question, Josh, would be, you have the unique position of being both a physician and a legislator, and when a controversial, and it's inherent just to the issue itself of death with dignity or physician-assisted suicide makes itself known in the legislature, what is your take on this particular issue, your position, and what is the likelihood that this will, one, see light of day again this session, and two, chances of passage?
You did save a very non-controversial question for last. I see. So historically, the medical community, and I found this very interesting when I was first elected in 2004, the medical community came out very strongly against physician-assisted suicide. That's been the position in Hawaii. And then also the faith-based community, you can imagine, was against. But one of the most compelling groups that were against the bills, this is kind of what had a profound impact on me, was the disabled community, which to a person came and testified against the bill. So I want to be honorable toward both sides of an issue like this, even though it's controversial. So I've twice heard the bill. Once when I was the chair in the House of Representatives, and then when I moved to the Senate, I said, hey, I'll hear it again. So I'm the only guy that's actually heard the bill in the last 8 years. Both times in my committees, it didn't pass out of the committee. In 2005 or 6, it didn't pass 8-2. It was 8 votes against, 2 votes for. And then in last year, again, I heard the bill, and I believe it was 3-2 or 4-2 against in committee. So I even held votes. I mean, the bill did get voted down. I don't know if the bill, I haven't heard personally yet if it's going to be introduced, but if it is, the House probably will think about hearing it. It did already get heard in the Senate during this cycle, though, so we don't typically hear a bill back-to-back, but you just never know, I guess.
Well, listen, I can't tell you how much we appreciate your information today and willingness to come on and share some light on issues that we're all concerned about. When you get back into town on Oahu, I hope you'll come into the studio and have a chance to chat with us and take some calls. We do value your service very much, Josh, and thank you so much for today. It's
my pleasure. Yeah, anytime you want to get at least a doctor's perspective or a legislator's perspective, I'll try to make myself free and available.
We appreciate it very much. Wish you all the best and take care till the next time.
You too.
Okay, bye now.
Aloha.